Men's sexual health. Have you ever wondered why your body knows exactly when to ejaculate even when you want to stop? That "I'm about to come" feeling appears so clearly, and then everything happens almost uncontrollably. In reality, ejaculation isn't a simple action, but rather a biological reflex controlled by the brain, spinal cord, and muscular system, operating with extreme precision through distinct phases. I'm not a doctor. I'm just someone who reads a lot of scientific literature about men's health and shares it in the most understandable way so you can understand what your body is doing and why it does it that way. If you're interested in straightforward content, no fear-mongering, no judgment about men's health, subscribe to the channel so you don't miss upcoming videos. The mechanism of ejaculation. Ejaculation is actually a reflex first. Understand that ejaculation is not entirely under conscious control. When there's sexual stimulation, the body sends signals from the genitals to the brain and spinal cord. When stimulation reaches its peak, this signal is transferred to the ejaculation center in the spinal cord. From this moment on, ejaculation is no longer something you can fully control with willpower. It occurs as an automatic reflex. Ejaculation happens through two very distinct phases. Phase 1, emission, sperm from the testicles along with fluid from the seminal vesicles and prostate are gradually pushed toward the deep urethra near the base of the penis. These structures contract rhythmically to gather the semen. Simultaneously, the posterior urethra expands 2 to 3 times. This is the point of no return. Many men describe this sensation as, "I know for sure I'm about to ejaculate and can't stop it." An interesting detail. In some older individuals, this warning sensation may fade or disappear over time. Phase 2, expulsion. After the semen has been prepared, the body moves to the expulsion phase. The bladder neck closes so semen doesn't flow backward. The external urethral sphincter relaxes. The pelvic floor muscles contract rhythmically to push the semen out, about ejaculation force. So how far can semen be expelled? In young, healthy males, semen can be expelled about 12 to 24 inches. In older age, as pelvic floor muscles weaken, this typically decreases to about 6 inches. You can self-assess very simply. I divide this into 3 groups for easy visualization. Group 1, if you've never ejaculated far, it's highly likely just a body characteristic, completely normal. Group 2, if you were strong before, then gradually decreased over time, it's usually related to age and pelvic floor muscles. Group 3, if the change happens suddenly, especially after surgery or medication, that's when you should get a medical checkup. See which group you belong to, and I'll explain each group in detail. Group 1, people who have never ejaculated far. Many men from adulthood until now have never seen their semen expelled far, and that doesn't mean it's abnormal. In reality, ejaculation force doesn't depend on a single factor, but rather the coordination of multiple systems in the body, strength of pelvic floor muscles, the foundation for propulsion, contraction level of muscles around the urethra, semen volume, and the level of nervous system activation at the moment of ejaculation. For many people, from the start, pelvic floor muscles aren't very strong, or the ejaculation reflex tends towards stability rather than explosiveness. So the far ejaculation phenomenon simply has never occurred. Important note, if the orgasmic sensation is still normal, no pain, no urination problems, then this is considered a normal physiological variation, not a disease, and doesn't need to be fixed. Group 2. People who were once strong, now gradually weakening over time. This is the most common group and also the most anxious group. When men enter middle age, some physiological changes occur very naturally. Pelvic floor muscles gradually weaken with age, sex hormone levels slowly decrease, nerve sensitivity isn't what it used to be, frequency and rhythm of sexual activity changes, common consequences include ejaculation force decreases, the shooting hard sensation is no longer pronounced, but overall sexual function remains stable. And here's the key point. This isn't deterioration, but rather biological adaptation with age, similar to changes in the heart, lungs, or muscles. Only when accompanied by signs like pain, significant loss of pleasure, urination problems, or very rapid changes in a short time should it be evaluated medically. Group 3, people who lose suddenly after medical intervention. This is the group that's usually most confused because the change happens quickly and very noticeably. Some medical interventions can directly affect the ejaculation mechanism, such as prostate surgery, bladder neck surgery, cancer treatment in the pelvic region, or using certain medications affecting nerves and hormones. In many cases, semen doesn't ejaculate outward but flows backward into the bladder. This phenomenon is called retrograde ejaculation. Important to understand, this isn't a loss of masculinity, usually doesn't cause loss of pleasure, and doesn't endanger overall health. The biggest problem in this group is usually psychological, due to not being fully explained before or after the intervention. Important things to remember. Not everyone is the same, and ejaculation force is not a measure of men's health value. What's more important is, do you understand which group your body is in? And are you worried from lack of information or because there's actually a problem that needs addressing? Whichever of the three groups you belong to, the common point is your body isn't broken. The issue only lies in some never had it, some change over time, and some change after medical intervention. And once you understand where you are, the next reasonable question isn't worry, but rather, can I improve it? The short answer is, in many cases, yes. But improvement here doesn't mean forcing the body back to how it was, but rather supporting systems that have weakened so the body operates more smoothly in its current condition. Professionals usually recommend approaching from three safe directions. Direction 1, strengthen the mechanical foundation. When the base muscle group in the pelvic area is properly activated, the ejaculation reflex is usually clearer and more voluntary, especially for those who feel they've weakened over time. Direction 2, reduce interference from stress and fatigue. Prolonged stress and lack of sleep make the sexual nervous system less sensitive, causing reflexes to not be as sharp as before, even without any disease. Direction 3, adjust expectations and rhythm of activity. Comparing yourself to others or to the past often creates reverse pressure. Meanwhile, slight, steady, realistic improvement makes the experience noticeably better. An important note, if changes occur suddenly after medical intervention, then the improvement approach needs to be personalized, not mechanically applying general tips. In short, it can be improved, but the goal isn't returning to the past, but being more comfortable and more in control in your current body. Specific exercises. What can you do to ejaculate more forcefully? The most important factor is pelvic floor muscle strength. One commonly mentioned method is Kegel exercises. You can feel the right muscle group by imagining you're urinating and stopping the stream just for identification. Or contracting muscles to lift the penis slightly without using your hands. Basic training method. Squeeze 5 seconds, release 5 seconds, repeat 10-15 times, twice a day. Here, better doesn't mean like in movies or better than others. Better is when you worry less, control better, and are more comfortable in your own experience. Important note, if you have pelvic pain, pain during ejaculation, testicular pain, don't self-train. Get a medical checkup first. Finally, I want to emphasize once more, your body isn't a machine and no one is exactly like anyone else. Understanding clearly which stage you're at, that's the most important step. From there, you'll know whether you need improvement or simply to accept and be comfortable with your current body. I hope this video has helped you understand more about how your body works and, more importantly, helped you worry less. If you found this video helpful, don't forget to hit like and subscribe to the channel to support me in continuing to make straightforward, no fear-mongering, no judgment content about men's health. Click the notification bell so you don't miss upcoming videos. And if you have any questions, leave a comment below. I'll try to answer. Thank you for watching. See you in the next video.